I've always been one for getting the most modern technology in the office. That being said, I'm never one to jump on the ship when something new comes out. There are a lot of new products and new techniques and procedures, some good, some bad. I'm always the guy to let other people try things first. What I'd like to deliver to my patients are tried, true, consistent solutions to problems, things that I know work. So when I'm doing a procedure, I know what the outcome is going to be. And we never guarantee results, but we know we're going to have consistent and predictable results with what we do, with the procedures we do. Part of that does involve investing in higher technology. We recently, within the last 2 years, purchased digital or computerized X-ray equipment. There are offices out there still using conventional X-rays. And to put things in perspective, with the digital or computerized X-rays, they produce up to about 90% less radiation. So that's a big benefit for the patients. Diagnostic options with those X-rays too, we can see a lot more. So we're able to be a lot more efficient with our diagnosis, a lot more accurate. We do have a laser in the office that we use for soft tissue, for gum treatment and for cosmetic work. I've invested in electric handpieces. No one likes to talk about drills. The old-fashioned drills of the old days would be running air compressors, high-pitched whining, and the dentist would be deaf by the time he retired, and patients would just hate the noise because it's just so unbearably high screeching. The drills we use are electric, so there isn't a high-pitched screeching. The cool thing for patients is they work very efficiently. What does that mean to the patient? Less drilling time, and no one's going to complain about that. In terms of Novocaines, we've had some dramatic breakthroughs in about the last 10 years. We're using newer types of Novocaine now that enable patients to get fully numb. So the days of having painful dental procedures are gone. Nothing is really totally pain-free, but we come darn close. The newer types of Novocaine are really, really good as far as getting people numb. I've had people come in that say they can't get numb, and we can get them numb. Another interesting thing we have is 2 other products in conjunction with the local anesthetics. We have a product that I like to call anti-Novocaine, a product called Oraverse, that we can give you another injection which you don't feel after the first one when you're already numb, but it essentially reverses the Novocaine. So we see a lot of business people who work, have to be on phones, don't like being numb all day, not being able to eat, not being able to talk. This particular product reverses the effects. So instead of being numb for 6 hours, you can literally walk out the office front door when you're done with your appointment and the Novocaine's wearing off. Really cool. Aside from that, we have another product on the front side that we use at the beginning of the appointment in conjunction with the Novocaine that makes the Novocaine much more effective. So in that respect, we can make sure that the patient is comfortable when they do get Novocaine.